the lecture of Séverine Lambert. Séverine was the student of Roselyne Laloz, one of the greatest osteopaths that France has ever had, that Europe ever had. Roselyne was doing so much by being first a kine and also an osteopath to change the vision that everybody in the scientific and medical world would have about all the osteopaths. She was creating the setup that right now Séverine is leading as the president. It is the Research Institute, European Research Institute in Pediatric Osteopathy. Séverine, I see that you are already connected. I will not steal more of your time.
Séverine, and you will share your screen, and so it's going to be very nice. Thank you so much. I'm very happy to be here. As far as this organization, as Jérôme told you, I was working with the service of Robert Moitié, and who I'm going to introduce now what is going during the consultation of osteopathy and what are the different knowledge that we need at this level. It is really important to understand what we are going to do during this consultation and our practice. So I'm going to tell you very quickly. So this is a quick question on anatomy, and this question is important. I can speak with the different doctors, and this is a small briefing and summary of what is important as far as the viscerocranium different question. So you have the patients that are followed in our hospital, Robert Debré, and also a little summary of what we do when I work with osteopathy. This is really important in the hospital, and this is what I'm going to do as a private practice. It is clear as far as this is really important, as far as the process is, this is really important to discuss from the first and second gill arch, and then the mandibular postmaxillary process. No, I'm sorry, I'm not in the right slide. And so we have the 5 buds, the nasofrontal bud, then the 2 maxillary buds, and the 2 mandibular buds. So that's really important. It is really important to understand that we see the face as such, and to see how the child is going to evolve and grow, so that we could have a notification that is going to focus on the neurovascular bundle. And this is really important. We should work on these zones, the epithelium, the growth potential of the mandible, and the vascularization of the face. So the facial vascularization, which is really important because we need to have an idea and see how be, let's say, acting really to change the face of our little patients. Because our face is open, lips that are well placed, and it is the same as far as the motor and sensory innervation. This is really important. You see on the different graph the face when the child is 5 months, motor innervation, skin muscle, facial nerve, masticatory muscles, trigeminal nerve, and so this is really, really important. We have the trigeminal ganglions, we have the sympathetic nervous system from the upper cervicus ganglion, we have the trigeminal nerve V1, V2, and V3, and so that's really important, and the auricle and gonian cervical plexus. So I would insist on the cervical plexus because it's really important. And then biomechanism, bone physiology, bone shaping, bone growing and resorption controlled by the mechanism of stress. So we work with osteopaths on this. All the evolution of the cranial facial phase of the child, which is so important that we have to understand as far as the primer ossification is concerned. We have also a greater plasticity in children, as you see, and we can act very easily compared to adults because the child is going to be flexible and we can work on it, and we can work with the child in a much easier way because he's just in evolution, he's growing. It's just like the elasticity and viscoelasticity is really important. We are going to implement some new techniques with mechanical properties of the living bones and see how we could reestablish the gravity and see how things are going to change very clearly. That's really important. The change in 55 days, change in the face, greater plasticity, as I said, of the children, and after 55 days we see a big change, 157% of change as far as the postural muscles and also bones are concerned. And I'm going to speak about posture, which is really different on sensors. So we have different sensor, endosensor, exosensor. So the proprioceptor and the viscera. So these are the endosensor, and the exosensor are the eyes, the jaw, the feet, the skin, the inner ear. So this is what we see. And these are all these integration systems that we should work on to give the best stimuli and have an independence and response at this level. We need to rehabilitate the spine, and this regulation is done through a system, as we see, an integration. We integrate as far as the muscle, the chain, the stabilization. And so we work on the different muscles to stabilize the child. This is the input at the beginning, and this is the output at the end. And so when we have this postural analysis done, so we try to analyze step by step. We see what are the different doors that we can enter, and we have a static analysis, and then we have the possibility to work. What are the zones on which we are going to work? That's really important as far as the maxillofacial question is concerned. The basis of the cranial muscles, so the morphogenesis and endogenesis is really important. The mouth, the face, all this is really important. And then we have this articulation, the xenoccipital articulation that is in link with the spine. It's the link between the cranial part of the body and the spine. And so we try to eradicate this bone. You have all the different question of the sacrum. So we will work on the different structures to eradicate the child and to have the best position ever. The goals are really important, is to activate the fascicular nervous elements, have also an optimal pressure on cheek and tongue, and this is important to stimulate restore the physiological function, mobility, structure function, preserving and activating growth, the postural balance, of course. So this is really important for the Froggymouth. We preserve the objective by checking what is important. We activate the face and muscle reflex loop. We are going to activate these reflexes and the way how we can regularize the subcortical system. So it is a multidisciplinary care. So now I'm going to show you some clinical cases as far as the different functional orthodontic appliances are concerned. So a multidisciplinary care. We use some different tools for patients, to children that are disabled and are trisomic. And so these are the tools that we use for children that have no teeth appearing. And so the objective is also the same, to give to the child a better breathing system, and so that the tongue remains inside of the cavity of the crane and the mouth. And so, and then what we see on the screen, so that the lips could be then placed in the best position for children that have some teeth. We work with the Froggymouth device. It's a small girl that has a facial asymmetry, 16 months, that's when she came. We see it when she was a baby. We can see it clearly that she has an asymmetrical face. And so this is the evolution, 16 months, 24 months, 2 years and a half, 3 years and a half. And you see how the growth is going until 7 years, and you see the difference on each picture. So, and she had the multi-froggy device. And so we just corrected all, and you can see on the picture the difference, the position of the teeth, the lips, and you see how when she was 2 years old and when she's now 7 years old. And so it's a big, big difference. You see how you can articulate all this. So it was really important, and this device helped quite a lot, I may say, as far as the maxillary posture, but also the position of the mouth. So it's a small patient that has got a trisomy 21, and we've been working with a multidisciplinary team. He had a sleep apnea. We needed a night ventilation equipment. He had a macroglossia operation that was scheduled for June. And he was treated since April 22 and was accepted immediately because we decided to work with the otolaryngologist, the physiotherapist, the maxillofacial surgeon, and the speech therapist. So it's a child that doesn't speak a lot. So some trisomic child are speaking, but this one doesn't speak much. But he has a lot of drooling, and that's really a problem because it comes out of his mouth. And I spoke to the father 2 days ago, and he said to me, and so he has less drooling. He has the two lips that are joined now thanks to the Froggymouth device. So he has a sleep apnea, he doesn't talk, He learned to work when he was 4 years old. He has no sphincter control for the moment. And so it's a very acute case. The treatment was multiple, but we had no problems. And so this is the reason why we decided in March to use the Froggymouth device, and he accepted immediately this device. And this is what we wanted to say. And I don't have a lot of significant results to show you, but the different children are really observing, and this is really important. It's one of the positive points I have to mention, and the possibility to wear it, that's really important as far as the prevention is concerned.
So here we have a little child. He's called Clément. He's 8 years old, and he's a little child who doesn't talk at all. He doesn't speak. He started walking at the age of 5, and here we had to give him some protections on the dentistry because he had big dentistry issues. His teeth were using themselves up, and everything, the payments were quite complex, but everything was paid for in the end. And then here we proposed Froggy to him in April, and you can see here a bit of saliva, but this was then immediate. The results were immediate. I don't know if you can hear him, but he was making sounds. And his saliva started to regulate in a totally different way. So his daddy, I saw him as well, and he said he keeps it 2 minutes every day, and he hears better too. It's a child that's making a lot more sounds than previously. And so here, I mean, this has nothing to do with pediatry or anything, but I wanted to show you a case of an adult who's 48 years old, and he came because he had migraine. And yeah, he's in multidisciplinary care. He has terrible migraines, and I offered Froggy to him in the second consultation. He was really observing, and with adults, I don't know how you do it. What I kind of offer is that they take it for a longer time, so that on a neurological level, it takes longer. So he wears it more or less 30 to 40 minutes a day, and you were really able to see the results. And when the pain starts to emerge, then he takes the Froggy and he puts it into his mouth, and there's no doubt that the Froggy helps him to regulate immediately the tonus and the balance. What helps me to decide? So I do this with the twins. The facial is implicated, and we have this all the time. And there's some cervical pain. I offer this immediately. So that's this is also for adults. This is why I decided to show you his case, because in the basis I used to use it for myself as soon as I had cervical issues, and when I noticed it helped me immediately. It relieved me, and this motivated me to also offer it to the man that you just saw before. So the hospital time has shown very positive results concerning pain. The patients feel very fast relief. Especially, it keeps its strengthens there a lot longer, and I see the objective is really to have these patients so that they keep this for a long time, which is very beneficial. And for children who have pathologies, genetical deficiencies, or who have pain, Froggy is very positive, and yeah, very positive indeed. Thank you very much for your attention. I hope that I didn't go over time or anything. Thank you, Séverine, that you participated in this wonderful congress. So that was very nice clinical cases, extremely interesting, and also to see the little patients with diverse handicaps. And with this approach, we can often see this. I'm afraid we don't have time to take the questions, so we've been a bit longer, but over time. So we're going to do the questions later with all the remarks that this has caused in various chats. So then we're going to have to answer it in the chats later. The viewers already know how to proceed. Thank you very much, Séverine, to have been here amongst us on the Froggy Day.